I'm Mackenzie King and I'm a student pharmacist.
I'm Michaela Brown and I'm also a student pharmacist. How can we help you today?
I have a headache. I'm stressed out from school and I have a lot of tests and assignments due in the next few days.
That's something we can definitely help you with. But before we get started with doing a recommendation for you, can I just double check that this recommendation is for you?
Yeah, it's for me.
And is it okay that we take about 10 minutes and talk with you about some of the options for your headache?
That's fine.
So I'm going to start by asking you some questions about your headache and some general questions about your medical history. What symptoms are you experiencing today?
I just have a headache.
And how would you describe your headache?
It's a dull aching pain.
Okay. Have you experienced a headache like this before?
Yeah, it happens when I get nervous or stressed out about exams. But it's just every couple of months.
That's understandable. When your headache started, was it gradual or sudden?
It was gradual. It started when I started studying.
Okay. Can you show us by pointing on your head where the pain is?
Yeah, it hurts in the top of my head and the back of my neck.
Okay. And is there anything that you do that helps it feel better?
If I stop studying, it feels better, or if I take a nap, it usually goes away.
Okay, that makes sense. What makes it worse?
When I start getting overwhelmed with studying, it gets worse.
Okay. So I have a pretty good idea now about your headache. So we're going to ask you a couple other questions about your medical history. Are you taking any other medications?
I take fluoxetine for depression.
Okay, and do you take any over-the-counter medications or herbal supplements?
Just a one-a-day vitamin.
And do you have any chronic conditions?
Just depression.
All right. I'm going to ask you a little bit then about other things. Do you drink or smoke?
I drink on occasion, but I don't smoke.
And then have you traveled anywhere recently?
No.
And what type of diet do you typically have?
Mainly just junk food, the normal college diet.
Okay. The thing that we know needs to just be fruit.
Okay, so now we have a pretty good idea about your symptoms, and we're going to recommend aspirin for you today, and this should help with your headache.
Anything to get rid of this headache.
Yeah. So aspirin's actually going to stop a specific enzyme that's in your body, and that enzyme typically leads to inflammation, which is what causes your headache. And it's going to reduce that sensitivity to the pain receptor, so it should definitely help for you. We're going to need you to take just one 325 milligram aspirin. That's just the regular strength aspirin. And we want you to take that by mouth every 4 to 6 hours as needed, but you don't want to take more than 4,000 milligrams per day.
So I just take one tablet?
Yeah, just one. But you want to make sure that you take it with food and a full glass of water. The common side effects that you typically see with aspirin is a lot of GI upset, so like upset stomach. You might throw up. Sometimes that happens. And then also heartburn is common as well. But there are some serious and rare side effects that we need to make you aware of, just so you can be on the lookout for them. Any signs of an allergic reaction, like any rash or any hives, anything like that, signs of bleeding, you start throwing up blood, or anything like that, you definitely need to keep an eye out. Kidney problems, if you have problems passing urine, confusion or ringing in your ears. A lot of times when the ringing in the ears starts, that can be an early sign of toxicity, so you just kind of want to be aware of that. And then finally, seizures.
I didn't know aspirin could cause all those things.
Yeah, it's very scary to hear a lot of the more serious side effects. And they are rare, but you just need to be aware of them in case they were to happen. Also, the fluoxetine that you're taking for your depression can increase the ability of the aspirin to cause bleeding. So we just need to monitor your therapy with that. If you are needing to take the aspirin for a headache for more than 10 days, you definitely need to see your doctor and talk to him about that, so they can just monitor all your levels of everything and see if there's something else that's going on. Something else I want you to avoid is alcohol, because alcohol can also increase that risk of bleeding. So you want to just completely not drink any alcohol while you're on the aspirin. And if you experience any of these serious side effects, you should get to the hospital as soon as possible. So now just a couple housekeeping type things. If you miss a dose, because sometimes you get busy and you're not thinking about it, Take a dose as soon as you think about it, unless it's close to when you would take a second dose. Then you would just skip that dose that you missed completely and follow your regular schedule. You are taking this on an as-needed basis, so if you don't feel like you need the aspirin, your headache's gone, you don't feel like you need it, you don't have to follow a strict schedule. It's just to help you with that headache. And then finally, you want to make sure that you're storing it at room temperature in a dry place and out of the reach of children.
Okay, and I know we talked about medication for this, but there are a few non-medicated therapies that you can use as well for like preventing your risk of cavity ulcers or else induced tension headache. So you can use some exercises to like strengthen the head and neck muscles to help prevent this, and find relaxation techniques that help you alleviate some of the stress from school. And breathing exercises or finding something else that allows you to alleviate your stress are good options for this.
I didn't know I could do that.
They're very beneficial for doing kind of just keeping yourself calm and thus releasing your headaches. And we'll follow up with you in a couple of days to see how you're doing. And I know we went over a lot of information about aspirin, but can you tell us what we just went over, just to make sure that you fully understand it?
Yeah, I take 325 milligrams of the aspirin every 4 to 6 hours if I need it and I still have a headache. No more than 4,000 milligrams a day, and take it with food and water if it upsets my stomach. And watch out for bleeding or ringing in my ears, and not to drink alcohol with the aspirin. And if I miss a dose, don't double up, but if it's not close, I can take one when I remember to take it. Stored in a dry place away from light, and I can do stretching to alleviate tension in my neck muscles.
Yes. Do you have any other questions for us?
Not at the moment, but I'll call you if I think of any.
All right, thank you.
We hope you start feeling better.